We're now being joined live from our Abuja studios by the Minister of Health, Dr. Osagie Ehanire. A pleasure having you with us.
Thank you. Good evening.
Now, we now have 318 cases, 70 discharged, but 10 deaths. Do we have cause to worry?
Well, at the moment, no, not much cause for worry. Let us say the rate of increase is a very slow incline, and a lot of it is very likely to be the backlog of cases that have been traced, and about 91% of the contacts have been traced. So the findings cause an initial increase in the number of cases that we have, and there's still room to watch and see.
Now, people seem to not have taken the lockdown seriously in places like Lagos and Abuja. We've seen quite a few defaulters. People say it's a hoax. So, do you have any plans to ensure that this message sinks in?
We have to increase our messaging. We have to also speak a lot with community leaders and religious leaders and the gatekeepers of society to understand the importance and the gravity of this disease. It is a disease that spreads extremely easily, extremely rapidly, and we have to continue to urge communities to not to congregate, to wash their hands thoroughly, to observe social distancing, and to take all those measures that have been advised in government, because the price of not taking these measures is very high indeed. So the leaders of communities should really take it seriously to advise their wards, and parents should advise their children that these injunctions from government are extremely important and should be taken should not be taken lightheartedly.
Dr. Ehanire, what role is the National Orientation Agency playing in this regard to ensure that the message really drives home?
Well, the National Orientation Agency is involving speaking to the public in the way that they usually do, through jingles, through public messaging, and giving messages as poignantly as possible so that it sinks in. Unfortunately, there are some people who tend to trivialize all of this because they haven't seen the effects. But those who have seen what is happening in other countries, particularly in Europe and the Americas now, will have a fear and know that if we act quickly and make a sacrifice now, we shall be able to avoid a lot of pain later on. So the message needs to be driven home, not only by National Orientation Agency, but by all other agencies and by all persons and those who have the ears of the people.
Now let's look at the issue of the Chinese doctors. They picked where they will self-isolate, but if the reverse was the case, this can't happen in China. Can you tell us more about the arrangement and their isolation so far?
Well, what we know is that before they arrive, we give them a message that in our country, when you come in from outside, particularly from a high burden country, you isolate for 14 days. And we also asked the Nigeria Center for Disease Control to go and look at the isolation center even before they arrived. So that was done. And by the time they arrived, the message was also given that they had to isolate for 14 days and that the NCDC will have the liberty to check on them randomly to see that they are actually observing the self-isolation. But I must also say that the authorities told me that every single one of those who came had a pre-boarding check and they were all said to be negative. Nevertheless, we did tell them that our regulations require that they comply with the 14-day isolation.
But why were they allowed to pick where they will isolate?
Say that again, please.
why were they allowed to choose where they will be isolated for those 14 days?
Oh, okay, because they have, yes, our understanding, they have a large compound, they have a facility, a medical facility. Remember that this is a giant construction company. They have been in Nigeria for 39 years and they have a lot of facilities in their compound. They told us that they have the ability to carry out the self-isolation. And we do allow self-isolation provided it has been inspected. And that is why we asked the NCDC to go and carry out this inspection prior to the arrival of the crew.
Honorable Minister, you applauded Nigerian doctors for doing well in handling this crisis. So why bring in the Chinese doctors at this time?
Well, in the first place, we didn't bring them in. I think the company, in its own wisdom and probably in its own corporate responsibility, social responsibility, thought they should bring people to come and help us and advise. We didn't issue any invitation, but we are not unhappy that they're here because we can learn from their experience. These people have been through it. We want to start with a video conferencing with them even while they are in isolation so that we can try to learn from their experiences. There is nothing better than learning from someone who has actually suffered an event and been inflicted with an injury. So there are people there who are specialized doctors and nurses, and what we can learn from them, we learn. But I think the company in its own wisdom thought that we will benefit from this kind of initiative. We didn't really ask for it or say bring us this. In fact, we didn't know that this whole gift was coming from the company. We appreciate it nevertheless.
Finally, Dr. Ehanire, what lessons have you learned from this pandemic vis-a-vis our healthcare system?
Tremendous lessons. The first lesson is that there is almost no healthcare system that is ready. You can see in review on television that a lot of health systems which are regarded as robust and almost invincible collapse under the weight of the outbreak, and which has really shocked people, shocked everybody around the world. We have seen how in very advanced countries, patients were being, patients had to lie on the floor because there were no more beds. They ran out of beds, ran out of ventilators, ran out of even simple things as masks. So the lesson is that one should be prepared. We should have stockpiles, and that is why even now we are very happy to have stockpiles. We want to continue to increase our stockpiles. We are grateful for what we got from donors, from everybody else, and we are getting another consignment from the United Nations very soon. The EU has also promised us something. We know that it's difficult to get commodities now. Even masks and ventilators are very hard to come by. And even if you place an order now, you have to wait a very long time. And because we do not know the magnitude of this outbreak, we put a lot of value on having a good stockpile of things that we shall require, including ventilators. We are getting 50 ventilators from the World Health Organization, and 35 ventilators are among the consignment that came from China a couple of days ago. So this addition of brand new machines will help us a lot. I'm doing an inventory of the intensive care specialists we have in the country to make sure that every state gets an intensive care specialist, a critical care specialist who will be able to use these ventilators. And I think about